Yes, thank you, Bruno. Thank you a lot for your kind invitation. Thank you, Manos, on all the team around Manos, because we know that the secretary, the sponsor, are very important to develop this shoulder course. So my topic today is to prove that under button is better than screw. This is my disclosure. You know that Laurent Lafosse described the first technique of full arthroscopy 13 years ago. It's a long time. With 2 screws, Pascal Boileau with 1 screw. It was a Bristol procedure. And after, in 2010, Pascal Boileau described with a screw, a cannulated screw, a Bankart combined with Bristol. So when you read the literature, you see that this is a very nice technique regarding recurrent dislocation, because there is no dislocation after 5 years, only 1 subluxation. But 10 patients return to the operating room. And what is the reason why they return to the operating room? 8 cases, they remove the screw. On 1 case, arthritis, 3 hematoma, this is complication, but more important is the screw. So Janez Hanyas-Kirchner, who is a very famous surgeon in Germany, he did the same technique on the 10% of revision during that hardware, osteolysis on non-union and problem with the screw. So Pascal with the Bristol Latarjet, he reoperated 4 patients, he removed the screw and he did a soft tissue repair. But this technique is very effective, because you see that there is 89% of stable no recurrent dislocation. So maybe the screw could be too broad, too long. Maybe it's difficult technique. You listen the previous presentation was very modest and very clear. Sometimes it's too oblique, sometimes it's too height. And if you use this technique without guide, I think that the learning curve is very important, because by arthroscopy you have a 2D dimension. It's not like your eyes with 3D dimension. And it's a reason why it's very, very difficult to have a good position of the coracoid process. And sometimes it's too lateral and you see that the risk of arthritis. Sometimes it's too medial and it's not enough for the stabilization of the shoulder. So there are many nerves, of course, and there is a risk of compression of the suprascapular nerve. So if you want to summarize regarding the screw, if you use a full arthroscopic technique with 2 screws, you have a risk of revision in 6 to 10%. It's the reason why in 2013 I developed a technique to try to improve this technique. The first, I use a specific Ledoic guide on coracoid guide, because I think that the positioning is easy. And I prefer double cortical button device or 1 cortical button device. This is a lock system, and I developed at the beginning with Biomet and now with VIMS. Why I use cortical button? In my experience, there is no reason to go to the operating room, because this is there is a self-locking device, there is less risk of bone fracture. We do small holes into the coracoid process, 2.9, and the material is very small, and we didn't remove any button. We use 2 cortical buttons if you want to reproduce the Latarjet with a big lack of bone, more than 10% or 15%. In this case, I use a big coracoid bone graft with 2 cortical buttons. But if there is a young athlete, for example, with 10% of lack of bone on the glenoid or a small heel sacs, I do a Bankart procedure, but I do augmentation with 1 piece of bone, a cortical button, 1 cortical button for the sling effect of the conjoint tendon. So with this technique, it's not necessary to have a medial portal, because you pull from posterior to anterior the button, and I don't use any portal medial to the conjoint tendon. I think that there is less risk for the brachial plexus. So regarding the concept, you have a video here. Okay. We pull the coracoid block from anterior to posterior, and the positioning of the coracoid block is guided automatically by the strands through the subscapularis, which is maintained open. So in my practice, this is between 2013 and 16, I did for 132 Latarjet with Bankart procedure. And this is by criteria. I use recurrent anterior dislocation, bone defect more than 10%, heel sacs. And I use some time for failure of previous Bankart procedure. I excluded in this series osteoarthritis, ankle lesion, and hyperlaxity. First intention after failure, I did after failure of Bankart, bipolar, on one case of Latarjet. We use systematically a CT scan with 3D reconstruction because it's very important to evaluate the shape of the coracoid process, because many times the orientation is very anterior, sometimes is curved, sometimes is small, and I think that is very important to define preoperatively, if you want to do full arthroscopic Latarjet, the shape of the coracoid process, because the difficulty is to have a flat abrasion of the inferior part to have a perfect matching between the coracoid process and the glenoid anterior rim. It's the reason why I think it's important. So in this series, I have 5% of revision. I revise with the reason of avulsion, of trauma, of early sports, and I revise with edenibinate by arthroscopy. I had 1 hematoma, 1 infection. On 12 patients kept an operation test. My first complication, because it's very important to learn. What is this? This is a non-union because I think that the matching was not very perfect. I have an avulsion of the coracoid process because he did sports after 2 weeks. There is no very nice result regarding recurrent dislocation, but in my series I have no neurological complication and no hardware removal. I think that regarding the healing of the bone, this is a problem in my experience, and it's the reason why I develop assisted arthroscopic technique. If you don't do a perfect matching, you have not 100% of healing. This is not the problem of the underbutton, it's the problem of complementary surface of the bone between the coracoid process and the coracoid. And it's not so easy to prepare with 2D reconstruction because it's very inferior. Even you use the arthroscope 70 degrees, I think that is not so easy. We validate the guide because we have no problem of lateral or medial positioning of the bone graft. And it's the reason today I continue to do Latarjet and Bankart with full arthroscopy or assisted arthroscopy. And you see that is more than 70% of my activity. And it's important that when you have not a big bone loss, but this is an athlete, like a rugby player, for example, I do a Bankart procedure. I augment with a little bone graft. I fix with one underbutton, extra-articular, because I think that the increase of the surface of the bone is important for the rugby player, and the sling effect of the conjoint tendon is also very important. And you can use, of course, 2 buttons if you have a lack of bone, and you can do 2 buttons like a Latarjet. So 2 buttons is very useful because there is no rotation, but it's a longer operation than 1 underbutton. There is a place for 2 buttons, there is a place for 1 button. For example, the young athlete after 10 dislocation, or teenagers, first dislocation, for example, 16 years, rugby player, 2 or 3 dislocation. If you do a Bankart repair because there is no bony lesion, you have a risk of 10 or 15% of recurrent dislocation. It's the reason why I do bone graft for augmentation of the Bankart repair. So this is an example here. With CT scan, it's very important to do after 6 months because sometimes 6 months is necessary to obtain a healing. So the question was why we abandoned screw. I abandoned screw since 7 years ago because I think that there is less risk of bone fracture of the coracoid process because the drill of the holes are 2.9 or 2.5. We didn't remove any on the button. This is a self-locking device. I don't do any knots developed by VIMS. We don't use any medial portal. Medial portal is very useful if you use a screw to be parallel to the glenoid joint. If you use a cortical button, the strands, when you pull the bone, follow the direction of the strands. And we have no more recurrent dislocation. If you have a good matching, we have 100% of healing bone, and I think that is very important for the patient, a good healing bone to have a good stability of the joint. Thank you for your attention, and I welcome to Paris maybe next year.